As the pandemic transitions to what officials see as an endemic, some of the damage done over the past 24 months will take years to undo. The healthcare system is still reeling from the strain of COVID as thousands of nurses left the profession.
CBS 2's Jessica Moore looks into the dire shortage and what can be done to bridge the gap between the resources and the need.
Nurses at Maimonides Hospital in the Bronx protest what they're calling unsafe staffing shortages.
Recently, I worked in situations where there was only 2 RNs on the floor. 2 RNs for a unit that used to have 5 RNs.
We need more help. This is not safe for us. This is not safe for the patients.
Since the start of the pandemic, nearly 400,000 healthcare workers have either quit, retired, or died of COVID, leaving a gaping hole in one of the most crucial hospital positions, nurses. Travel nurse Gilbert Banda spent months at hospitals across New York City at the height of the pandemic.
It was a lot of death. I've been a nurse for 16 years, and I've never had to bag bodies after bodies.
Pediatric ICU nurse Cheryl Leo says her work is her passion, but it's not for the faint of heart.
Standing there holding a patient's hand so they wouldn't be alone when they died. And it stays with you.
Last month, hospitals in 18 states reported critical staffing levels, including New York and New Jersey. Many nurses say they're burned out, underpaid, and overworked.
Maybe I'm only supposed to have 1 or 2 patients, but then I have 3 and there are 3 sick patients, and I just don't feel like I can give, 100% like I want to give. It makes you feel defeated.
Hospitals typically staff 60 to 70% of nurses and bring in travel nurses to bridge the gap as needed. During the pandemic, those numbers skyrocketed. One travel nurse agency says Bronx hospitals employed 39% travel nurses in 2020 and 74% in 2021. Experts say it's a pipeline problem.
An entire generation of baby boomer nurses with great experience are retiring at the same time that those nursing schools don't have enough teachers because of that same population retiring.
To make matters worse, the Bureau of Labor Statistics says 70% more nurses are needed every year to fill the chronic shortage, but only 4% of students are studying to become nurses.
It's more critical than ever for us right now to be encouraging young people, high school kids, college kids, to consider a healthcare profession.
Nurses switching careers tend to seek out jobs that bring less stress and more money.
Just the value of what you do, you should be compensated for it.
If the pandemic has taught us anything about the healthcare profession, it's the value of those who care for us when we need it most. Jessica Moore, CBS 2 News.